everyone. We haven't. I'm having a little technical difficulty. I hope my voice is carrying okay.
You're going in and out.
Yes, thumbs up.
You're going in and out.
In and out. In and out. Yep. Well, I let me apologize to the viewers and to my panel. Unfortunately, my area is experiencing some difficulties. I've been trying to have that resolved since this afternoon, but it's still intermittent.
So that entire sentence came out very clear.
Maybe talk too soon.
Um, so I think the silence is gonna, I guess, assume
So,
control until somebody can come in. How about that?
do you guys hear me okay?
Yes.
Good. Apologies for this. It's just going to be one of, but it's just unfortunate that I'm having some super difficulties here on my end. I think I have to get a backup system installed going forward in case one fails. Then we can be alive. Anyway, I want to welcome all the guests on the panel this evening. Thank you so much for taking time off from your busy schedule, and I want to welcome those online on Facebook and on YouTube that have tuned in to listen to us to get some information on the pandemic, and more particularly on vaccinations, how they're developed, the effectiveness and the use in society, and why the Freedom Party is on board.
It's looking like we have lost Bernard again, but on behalf of the Dominica Freedom Party, of which I'm not a registered member, to say good evening to everyone. And see, Bernard is on again. So, Bernard, you can take over again.
Yes, I will try to quickly get through the introduction so you guys can take it over. So we have a distinguished guest of medical doctors and researchers and a combination of both professions online. Let me quickly introduce them. Let's start off. We'll start round robin here. Let me start off with Dr. Sophia George. She's a PhD, associate professor in the Division of Gynecological Oncology within the Department of Obstetrics, and Gynecology. I'm not a medical guy. Of Medicine, and a member of the Sylvester Comprehensive Cancer Center in the Cancer Control and Population Health. She's a molecular genetist, graduate from the University of Toronto, Ontario, Canada. She then did a postdoctoral training in molecular pathology and gynecological pathology at the Princess Margaret Cancer Center, and so forth. And she's a faculty position at the University of Miami Miller School of Medicine right now. She's funded by the Department of Defense Ovarian Cancer Research Program and the NIH. She has been featured in the Miami Herald and Forbes magazine about her work. She serves on the board of Gilda's Club of South Florida and the T. Gallery Foundation. And she has worked regionally, nationally, and internationally in communities of color. She is a Dominican, and she's involved in several research areas related to genetic mutations in Afro-Caribbean nationals, as well as being the co-leader of the Women's Cancer Working Group in the African Caribbean Cancer Consortium. All right, moving right along, we'll talk a little bit about our next guest here, Dr. Angelo Guerrero Pena. She's currently in her third and last year of pediatric residency, in Peoria.
getting Sophia. Dr. George, since you know Dr. Pina very
Yes.
well, you want to finish that introduction?
Oh,
Or do you want her to do it herself?
actually, Angela, you want to introduce yourself?
Go ahead.
Yeah, my name is Angela Guerrero Peña. I'm a medical doctor from Peru originally, and I studied there, worked there as a family medicine doctor. I did different service. I worked in ICU, in outpatient, emergency, and then I decided to come to US and do the boards, the medical boards, and apply for medical training. Um, in that period, I was doing an MBA as well and completing my clerkship in different hospitals in Georgetown and University of Miami, Whole Children Hospital. When I finished all the requirements and applied for for residency, and I am matching in Whole Children Hospital, where I'm currently in my last year of pediatrics training. So I enjoy and learning a lot. Every day is a new challenge, and I'm so glad that I'm Latin, and we see a lot of Latin population in our hospital, and it's good to have diversity since the patient feels represented and they will follow your instructions. Is very important. So I'm grateful for this invitation and share all these things that I know regarding this virus, the pandemic, and the vaccines.
All
Thank
right.
you.
Thank you. Dr. Lafont, you want to take a...
Yeah, Jeffrey Lafont, um, a Dominican graduate, I'd say scholar, attended the St. Mary's Academy, number one school in Dominica. Thank you. And said that from my fellow Dominican panelists. I graduated from the University of the West Indies some time ago. Did a postgraduate degree in obstetrics and gynecology in the United Kingdom. Obtained a membership of the Royal College of Obstetricians and Gynecologists. I was later elevated as a fellow of the Royal College of Obstetricians and Gynecologists. I've been admitted as a fellow of the American College of Obstetricians and Gynecologists. Presently, I'm both in public and private practice at the Queen Elizabeth Hospital in Barbados, where I'm based. I used to be the head of department. I'm presently acting head again of the Department of Obstetrics and Gynecology. I am a lecturer and tutor, both undergrad and postgrad medical students. Presently, the lead consultant for all obstetrics and gynecological COVID positive patients. So I lead a small team that deals with all positive COVID pregnant patients and women with gynecological problems who are COVID positive. As well as I head a protocol committee for COVID and COVID related issues in the Department of Obstetrics and Gynecology. Presently, the second vice president of the Barbados Association of Medical Practitioners, for which we have a COVID task force, which advises the government and does some sort of advocacy for both public as well as our members. I'm happy to be in this distinguished panel, and hopefully we could have a meaningful discussion on vaccinations, the effect of COVID on Dominica, as we really want to relate to Dominica and our best way forward with regards to reducing the effects of COVID in the country.
Thank you. And my name is Gregory Vidal. I'm really pleased to be here. I'm from Portsmouth. Went to PSS. We know which is the best school in Dominica. And moved to the US for undergrad some years back. I hold a master's degree of science, MD, a PhD in structural and molecular biology, and I am an oncologist by training. I trained over at Stanford University, now residency fellowship, postdoctoral fellowship, did some research there. Currently in my practice, I'm a breast medical oncologist, meaning I just see breast patients, but I'm a general oncologist by training. And half of my time is focused on research. My focus is mainly what we call translational clinical research, so drug development. And so I have a little insight into the development of the COVID vaccine, for example, because that's my area of expertise. Uh, Currently, I do have patients on chemotherapy who are immunosuppressed who have COVID positivity. I've lost a few people. I have some experience dealing with them, and I'm happy to be here. Uh, I think we're going to just go through this on our own and see if we can get some insight into what's going on in Dominica. First question is, how is the COVID situation like in Barbados?
You have to repeat. Sorry, I didn't hear that prop.
I said, what is the COVID situation like in Barbados as compared to what you know going on in Dominica?
Um, Barbados, at this present time, is having, I don't want to call it a third wave. Within the last month.
Okay. It looks like the internet bug is biting us everywhere. All right. Dr. Pena, there are numerous vaccines on the market. So I do know, having spoken to some of my friends and family in Dominica who have concerns about vaccines. Can you tell me about the vaccines that are on the market and your impression of their safety?
So in US, we have the Pfizer, that is 2 doses, 21 days apart, and the immunity will start at the second week, at least of the first dose, and then the second dose will be a booster of the first dose. And so the efficacy of the vaccine will be improved. We have Moderna, that is similar mechanism, that it has the same mRNA technology, and we have the one that is the Johnson & Johnson is just 1 dose, that use a vector. The efficacy was created later comparing with the Pfizer and the Moderna. There are some suggestive data not yet clear, that because it was created early would protect a little bit better against Delta variant. Safety. There are, for the Pfizer one, there have been reports of some allergic reaction or anaphylaxis, but it's very rare. But comparing with the regular vaccines, it's still a little bit high. For 1 million of doses given, there was like 2.5 cases of reactions, mild, moderate, and severe. I don't have the breakout how many were mild, how many were moderate or severe, but there were some reactions. To my knowledge, there was no death related to vaccine correlated. There was a case of obstetric doctor that got the vaccine and he had thrombocytopenia and complicated, but there was no clear correlation with the vaccine. I'm not sure they are still studying the case. But this is, most of the people are afraid of anaphylactic reactions. But this is a very rare complication. Will be more concerning in population that have reactions, previous reaction to vaccines, but not for somebody who have regular vaccines as a child. Then the regular vaccines that we had influenza every single year, they don't have any complication. There is no any concern. Moderna is similar. Regarding the Pfizer, the Johnson & Johnson, there is, I haven't heard reports of anaphylaxis, but because this is still like a foreign substance getting into the body, there were some mild reports of allergic reactions as any other vaccine.
Do you know of any, and Dr. George, you can jump in here too. Do you know, currently in Dominica, I think there have the Chinese vaccine, Sinovac, I think is the name, and they've had AstraZeneca vaccine. Do you know of any safety concerns with these particular two vaccines?
Not that I'm aware of. I do know that the efficacy is slightly lower than the mRNA vaccines like Pfizer and Moderna, but they're still within the effective range, but none that actually, these vaccines that we have in Dominica have been used in Dominica are the more common types of vaccines that are generated through adenoviruses.
Can you speak a little bit more about that? Since you brought it up, so we've heard a lot about sort of the mRNA vaccine, and which is the Pfizer and the Moderna, and then we do have two other types of vaccines that are in Dominica, but those are not mRNA vaccines. So can you talk a little bit about what differentiates those two?
And then Angela, you can always correct me, okay? So first of all, the mRNA vaccine, why is it an mRNA vaccine? An mRNA is part of the cellular machinery that encodes proteins. So that was really a cool technology that has been around for a while, but was rapidly implemented in the response to this pandemic last year. In general, vaccines that have been usually used as what we got as a kid, and also those that we get for booster shots as adults, are usually adenoviruses. And these are viruses that have been inactivated so that they themselves cannot replicate. And they hold in them the protein that is similar to the virus or the bacteria that we're trying to build an immune response against. And so that is the biggest difference. One is an inactivated virus and this is something that has been used for a very long time. That holds the antigen, that protein that is going to tell our immune system that we need to build immunity against it. And the other one, the mRNA vaccines like Pfizer and Moderna, have just the mRNA that our cells then use to make protein so that our immune system can build an immune response against it. The mRNA itself is not stable, so it's not going to hang around for a long time in the cells. It gets degraded, and so our immune system will build the immune response. That's why sometimes you have a little fever, swelling in the spot that you're injected, and then the antibodies that are made, and then they become a memory, and they go into hiding until they're ready to act up, to go into defense of our bodies when we are exposed to, for example, the coronavirus.
So you've said we've talked about a lot of terms here. I'm trying to simplify this a little bit more. So what's the difference between an mRNA and DNA? And what's the link between them?
Sure. Okay. So the DNA, so all of our cells, except for mature red blood cells, have DNA. These are the instructions that our cells have to make us and for us to be who we are. And how that works is that DNA is stable, and it encodes for genes and therefore proteins that allow us to look the way we look, for our cells to function the way that they function, for us to have hair versus toenails versus fingertips, and so on. And so what happens is when there is when the cells need a protein to be made, there are processes that happen at the DNA level, so that's stable, that then gets initiated to make mRNA, and that's what we call that transcription. And so DNA becomes becomes transcribed to mRNA, and that mRNA, the M means a messenger RNA, and the cells then use protein amino acid building blocks to then make protein from the mRNA, and from the mRNA to protein is called translation. And so the mRNA itself is not very stable. As I said, DNA is stable. That's we inherit our DNA, whereas mRNA is made for a short time to transmit a message to make a protein so that the cells can continue doing its normal activity.
So if you were to put it in the form of a factory, say the DNA holds the knowledge, that knowledge has to be transported to another part of the factory in order for it to produce the product. And that molecule that transfers it from that information to the product is the mRNA.
Yes.
And so what we're doing with this particular vaccine is, instead of giving you the DNA, we're giving you already that message that makes not the entire COVID vaccine, but just the message that makes the foot of the COVID virus, It just gives you the message that just makes the little legs on the virus. But even those legs are foreign to the body. So once those legs are produced, the body then creates immune cells to the legs. So anytime you have a true virus infected, those legs then turn on our body's immune system to then fight and kill the bacteria. Kill the virus. Dr. Lafont, are you back?
Yeah, I'm alive with you.
So we were talking a little bit more about the different types of viruses, vaccines. I don't want to leave too quickly the different types of vaccines and how they're made, because there certainly have been concerns about mRNA giving you genetic material. And people are concerned that that gets instituted into your DNA and can change your DNA. Like Dr. George said, this is very unstable. This doesn't hang around, it breaks up. Once it gets there, it doesn't get instituted in your DNA. The type of vaccines that we have in Dominica, and I'm assuming in Barbados, is the Chinese vaccine, which is sort of heat inactivated. So it's an inactivated COVID virus that is put in your body to create same immunity, or the AstraZeneca, which is a different type of virus we use that doesn't cause disease, and you put that genetic material in that virus to make those same legs so that the body can make immunity. What type of vaccines do you have in Barbados, and what is the uptake of it in the public?
Yeah. Okay. So, well, both Dominica and Barbados will be getting the same vaccines because we get it from the same sources, whether through COVAX, whether we got it from the Indian government or we're getting from the US government. So at present, both Dominica and Barbados would have the AstraZeneca, and Dominica should have gotten some Sinopharm vaccines, that's from China. Those are the attenuated viral vaccines. Barbados have recently gotten some Pfizer, which would be an mRNA vaccine. And Dominica, through the US government, will be receiving the Pfizer vaccines as well. Maybe, I know we don't need to go too much into the types of vaccines because I'm not too sure who's our listenership. We don't want to confuse them. Okay, but it's important to dispel disinformation. I'm happy you went into what the mRNA vaccines do, because one of the things people are worried about is, will the mRNA vaccine get into my DNA and change who I am? The answer to that is no. So that's sort of information we should be putting out there, that the mRNA vaccine is not going to change your DNA. So the answer to that is no. There are differences between the mRNA vaccines like Pfizer and the AstraZeneca and Sinopharm. Yes, they are. The availability of them, for sure, we have to let people know that the best vaccine is the one available to you. Okay. Definitely. So if the AstraZeneca was out there and it's available, you take it. Now the Pfizer vaccine, the efficacy is a little different from the AstraZeneca vaccine. We know the Pfizer vaccine is approved for children above the age of 12 because enough work has been done so that it has been approved for children. So I know in Barbados definitely a rollout for between children between the ages of 12 and 18 to get it. The AstraZeneca vaccine has not been approved for that age group as yet. So definitely the Pfizer, which is one of the mRNA vaccines, will be used in children. So that will be increased an uptake in the number of people being vaccinated. Another important point to note, because I'm in obstetrics and gynecology, both the American College of Obstetricians and Gynecologists and the Royal College of Obstetricians and Gynecologists have approved the Pfizer vaccine, which is an mRNA vaccine for use in pregnant and lactating women. And that's important because initially they did say no towards it. However, after the studies have shown utilizing 164,000 women in the United States, where the vaccine has been shown to be safe, effective in preventing death, ICU admissions, and severe illnesses in pregnant women, it has been approved, in pregnant women. You asked me about the uptake of the vaccine in Barbados. At this present time, is about 32% of the population. And they're hoping to strive to at least 70%, but it's a little battle. The battle is because
do you have vaccine available to vaccinate 70% of the population?
The answer to that at present would be no, but it will be done in stages as the vaccines come. The hindrance is a number of vaccines and the uptake. So, and I'm happy the Freedom Party is having this sort of discussion so that, people can, after we leave tonight, the other people can go out there and influence others with regards to the uptake, because we have to appreciate the reason we are pushing the vaccine is because it reduces severe illness, it reduces hospitalization, it reduces death. And especially in a small country like Dominica, when you have one main hospital, you don't want that hospital to be overwhelmed with COVID cases. Because you get overwhelmed with COVID-related cases, then everything else is put on the back burner, and then you're going to have increased sickness, illness, and death from other ailments, which the hospital would have normally been taken care of. So that we have to signify the importance why we are pushing the vaccine and why we're having this discussion today.
And another very important part of that conversation too is the other sort of supportive medication that we use to support somebody with a severe illness in the US, for example, the monoclonal antibody. You have Regeneron and Remdesivir. I think I said that word incorrectly, but those are not necessarily available in Dominica. So somebody who has a severe COVID may not have the same outcome as somebody here at this point of time in the treatment of COVID. Dr. Pina, have you seen any, especially in kids 12 and older, have you seen any adverse event in that population? What is the uptake? And what are the hesitation that you're hearing from those patients or family members in regards to vaccinating their kids?
Do you mean for the vaccine, correct?
For the vaccine, for younger patients.
Yeah, there are still resistant in the younger population, but I think at this point people is more conscious. We have a 17-year-old with severe pneumonia for COVID. You was in the ICU for many days, and we have babies that we never see this before with severe pneumonia. Before last year, we have now the Delta variant. Last year, we have mild symptoms in kids, like any virus, and severe symptoms in adults. But now we are seeing a shift. It's a big difference. Now the kids are becoming very sick from COVID. So we will start like advocacy uh, program in the hospital, just to push in every clinic encounter in the emergency, in anytime you have the chance to speak with parents, the importance of vaccines, starting from them as a parents to give the example to protect their kids, and then the 12 and older kids get the vaccine to protect themselves, because it's this variant. Every time that we have less people vaccinated, the virus had the opportunity to mutate in your body, and it will become a new virus, more pathologic, more infectious. And people vaccinated, the virus had the opportunity. Oh, sorry, I hear myself. uh, and then means that unvaccinated population, of course, they will be more prone to have serious diseases, but the vaccinated people, we will have the risk to get the vaccine, to get, sorry, the virus and become sick as well. No as the no vaccinated, but they still can get sick. We have few cases in our hospital, in adult side. Vaccinated people become very sick because this new variant, thanks to the large population didn't believe. I totally understand. There was like a new vaccine made in record time, and there was a large population unvaccinated, and the virus mutate, and that is affecting the vaccinated people as well. So that's why it's very important to be proactive in this. So as soon as many people become vaccinated, fully vaccinated, the virus stop mutating, and we will protect our kids. Any problem?
Thank you.
Yeah.
Oh, sorry.
Thank you. Thank you. Thank you very much. I am back on audio wise. I don't have enough bandwidth to be on the video, unfortunately. Looks like my whole region is experiencing problems, but let's do the best we can. I thank the panel for soldiering on while we try to solve this. Let me just ask this question to the panel. I'll open it up, and maybe we can take it one at a time. There was a time that vaccinations were pretty routine. Everyone was vaccinated as children, and for various things as we went through our stages of life. Why do you all think that vaccinations has become so controversial as of late? And why has the psychology of the population and folks in general seem to be so heightened? Can you pinpoint a time, place, and phenomena that changed the public perception of vaccines and the effectiveness of vaccines? So I'll open it up, and maybe we can take it one at a time.
So that's a complicated answer for sure, because there are many different parts to it. One is there's been a movement, sort of an anti-vaccination movement in the US long before COVID, that have falsely associated vaccination with autism. And that has been disproven many times. And so there's a group of very well-known people who are popular on television who've been pushing that. What we've seen is things like mumps that we thought we had eradicated because some people have stopped doing their vaccination. So that's one issue. The other issue for COVID vaccination is because it had become politicized. To the point where it should not have been. It's a health care issue, not a political issue. So people are on different sides of the political, on politics, especially in the US, we're taking different sides. Because of that, there have been incorrect information being put out there falsely, and because of social media, those things, they propagate very rapidly. So someone who is not looking to get the correct information can go on social media and get just the type of information that they want to hear, even if it's false information. And so there are a number of different reasons for that. And I guess our hope is that with these sort of programs that we can try to sort of get those folks back in and at least not only listening to us, but going to reputable sites to get the correct set of information.
Yeah, if I may jump in as well, as Dr. Vidal rightly said, the increase of social media and the information age, so that disinformation can be propagated easier. We have people who are figuratively pro-choice or anti-government. We have that movement who don't want to be regulated. And medicine and healthcare has been its own victim in that people don't see sick people as much. So where 50 years ago, you'd know of 2 or 3 or 4 or 5 or 10 children dying of polio, whooping cough, pertussis, yeah? And people recognize the need, to get vaccinated. Now, because we have done so well in healthcare and keeping these people alive, yeah, people are obviating the need, for vaccinations. So, it's a double-edged sword. We have done better in managing those communicable diseases. Yeah, even with COVID, a lot of people rather take the chance to get COVID than take a vaccine. Why? Because they believe COVID is 80% of people might be asymptomatic. Okay,
Well,
so
I
that
will
people
tell you
say,
for sure. Sorry, I will jump in here and tell you I have had friends and patients who had regrets. One of a very close friend of mine, who is in his 40s, very healthy guy, anti-vaccine, got so bad that he had to go in the hospital, and he just kept saying, "I'll take the vaccine now." But that's a little bit too late. So sorry for jumping in, but I just wanted to put that in there.
no, that's fine.
Yeah.
That's fine. But people, because the literature and people are hearing that 80% of people, will get mild COVID and they'll be, or you may be asymptomatic. So once people are not seeing sick people or dying people, they're likely not to take the vaccine. Okay, but once a relative dies, once they'll have severe, have to be intubated, lose weight, reach near death, they will take. They more than likely will take the vaccine. So you do have these anti-vaxxers out there until they see illness upon themselves.
So I can jump in here. Another thing that we should I can see contributes to what's happening is maybe a difference in the level of education, science education, and also at our own detriment, folks in the biomedical space not communicating and disseminating information in a digestible way to the lay public. So of course, I'm in a space where I understand what DNA and mRNA is. And many people do not remember or have never been exposed to those terminologies and those terms. And so they use, and it's all actually unfortunately easy to, listen to some of this information, hear people talking and just be able to dismiss it right away, because we have that, at least amongst us here in the panel, have that level of, we're informed that we understand the difference. But the general public clearly doesn't, or at least a big proportion of them do not, because they're thinking of the that particular type of vaccine that's integrated into their DNA when it cannot. And so we have to do a better job in the public health space of explaining, right? And as Dr. Lafont said, that we've been very good at treating people very young, actually, right? We have great public health programs preventing diseases early on, so people are not seeing the impact of these and actually almost eradicating essentially many of these diseases, so they don't see it, versus what's happening now, where we're seeing it and we're feeling it, and this information circulating, that seems to be also salacious and putting fear into people, instead of getting them to protect themselves and their family members.
Yeah, I often tell my friends and people who ask me about it, had it not been for vaccine, your life as you know it wouldn't be the way it is. All of these other diseases that we've eradicated would be threatening your life. And lifestyle wouldn't be what it is right now had it not been for vaccines.
Dr.
Yeah.
Barrera?
Dana, is Bernard on?
Is Bernard,
Yes,
are you still there? Yes.
I am. You guys hear me?
Yes, we do.
Yeah.
Okay. I believe we've all addressed the question, right?
Right.
Yeah. Okay. The concern is actually is raised right here on the chat, and let me throw the question to the panel here is there's a thought that the vaccines today are different. The ingredients in the current vaccines are not comparable or not similar or different bits to the vaccines administered to us as children. They seem to be okay, that the vaccines they took as children were okay, but these vaccines in today's era is somehow different. How would you guys respond to that?
That is not necessarily correct. So the only sort of unique vaccine technology, and it's not really unique because this technology has been out there for a while, but it's the first time it's been used for, I guess, COVID vaccine, is the mRNA vaccine. And because it's mRNA, it had to be coated again, it's unstable. It had to be coated in a special formulation, which is mainly just fat, lipid formulation, so that it's protected when it's in the body. The AstraZeneca, the Sinovac, the Johnson & Johnson, the Sputnik, those vaccines use similar technology to the ones that we've had before. Those are not different. So that there, and the ones that are available in Dominica, those shouldn't be different from the vaccines that you're accustomed of taking, from an ingredients perspective.
Mm-hmm.
Certainly. Other thoughts? I think that's essentially correct. And in any event, science progresses. It would be inconceivable that we would approach medical care and any scientific endeavor in the same way that we did 50 years ago. We learn more, we get more effective understanding, we understand the science better, our technology increases, and so we progress in our treatments as well. It would be inconceivable that it would be anywhere else.
Yes,
Correct.
and so to
What
add, even if
about
the
those?
Pfizer vaccine, sorry, and
No,
even
go
I
ahead.
wanted to add, even if the Pfizer and Moderna uses a different technology, none of that ingredients that is being placed is known to harm human beings. All of these are safe.
Yeah.
So one of the things, so the chairman of the Department of Medicine said a few weeks ago, I was listening to a town hall, and he said that if you eat hot dogs, you should run a blood with components of the vaccine. And when he said that, it was really it really painted a picture for me, right? Because we consume a lot of things, and without thinking about the components. And yet something as these vaccines that have been looked at, and the fact that we're talking about it and talking about the components is a major step in terms of our own consumption of what we put in our bodies. But yet the foods that we eat and some of the products that we use on our bodies and our skin, we don't even pay attention to those. Okay. I feel very safe with at least I got the Pfizer vaccine, and I'm expected to eventually take the booster shot when it's available to me. And yeah. Dr. Penna, you wanted to say something?
Yeah, for example, the components, inactive ingredients that comes with this vaccine will be sodium chloride, that is like salt, cholesterol, these type of things that doesn't have any effect, like a bad effect. Most likely, the side effects might be related with the active component of the vaccine. We are not trying to hide the side effects. If there are some side effects, like, for example, mild things like myalgia, fever, fatigue. That means that your lymph nodes are making their work to produce the antibodies against COVID. This is a good sign. But there are other signs that can be more life-threatening or concerning, like inflammation of the heart that we call myocarditis, that can cause, it's rare, but can happen. Even with this, in kids at least, even with the COVID infection, it will most likely develop in some kids myocarditis than with the vaccine. The vaccine may cause few cases, but it's most likely to having an active disease. Like cause inflammation in the heart, the left ventricle is not pushing the blood, and the blood is not going to the tissues. So this is a problem. But with early interventions, we can address that issue when it's an active disease. To prevent that severity, we have the vaccines.
Yeah, and you raise a point there that I want us to pursue a little bit more. I mean, any ad you listen for any medication in on television or anywhere would probably traumatize the average person if they did not use a certain amount of common sense in the risk levels, right? I mean, there's a whole long list of things that are said for every medication in headache medicine. There's always just that revelation because it's science and they have to be you put out all the possibilities there. But there's possibilities and probabilities are often understood by most people that those things that are listed are not likely, and therefore they make a good risk judgment. Why do you think that sort of calculus, that sort of
I think
is
I
not
understood.
seeming not to?
I think I understood the question. First of all, if people are hesitant about taking something in the first case, they're going to try to find whatever excuse there is. In my business, I get that very similar hesitation because I give chemotherapy. I give therapies that are themselves very toxic. So when you go through and you look at the potential side effects, almost every one of them has death as a potential side effects. But when I speak to patients about the need for it and your chance of actually experiencing those adverse side effects, then I explain to you that your chance of dying from this drug is so rare that the risk to benefit ratio highly favors the benefit. But again, not everybody is made the same. Not every person is made the same. And therefore, there are some people who have adverse reactions. Great majority of folks will not. There have been 5 billion people vaccinated in this world. 5 billion. At this point, we would be seeing severe adverse reactions that are much more life-threatening. Those would be making the news because a lot of people have been exposed to this already. We need to do more, but there's a lot of people who've already been vaccinated. And I think we've learned a lot about it. And for most part, this is a highly safe type of medication. But Terry, Alexis,
anyone wants to contribute to that answer or discussion?
I just wanted to add.
Go ahead, Geoffrey.
Mr. Well, what we have to understand and let the listening public know that every drug that is manufactured will be tested, okay? And once there's a side effect, it will be documented, okay? Some side effects are greater than others, yeah? And all the side effects have to be highlighted to the public, and the public will have to know. Some places indicate that it's only if you have a side effect of about at least 1%, then they will highlight. Other places highlight every single one. So we have to make the public know that the vaccines also have side effects, and we have to be truthful about that. Once we try to hide that, then we will lose a little credibility. And as Dr. Vidal did say, 5 billion people have been vaccinated, so we expect a certain numbers to have side effects, even death. And a few people have died because of the side effects of the vaccine. But what we have to appreciate, the benefit far outweighs the risk. And that's what we have to let people know at all times. Yeah. And what are the benefits? It reduces severe illness, it reduces hospitalization, it reduces symptomatic illness, it reduces the need for ICU, and it reduces death. Okay, and that is what ultimately we want. So yes, the vaccines do cause side effects, but they are minor compared to the effects of COVID, and that's the point we need to highlight.
Great.
another
Dr. George, you had a point you were trying to add? I think you were trying to say something.
Yeah, I was just saying that in the context of the utilization of the vaccines across the biomedical and healthcare work, at least in the United States and in Europe, I know that there is a less of a utilization in some countries in the Caribbean, but hopefully increasing utilization. Is that I've had to tell folks that if we are taking it and literally first in line to take it, and we'll take a booster if that is what is required, then we wouldn't be putting ourselves at risk. One, because we have a responsibility to our family members, but also to the people that we serve, right? And so the fact that there is this skepticism about us, because someone mentioned about us pushing the utilization of the vaccine, it's really because just like any other medication, that if you're diabetic, we would want you to take an anti-diabetic medication. If you're hypertensive, we want you to take medication that's been shown to help manage your hypertension. For example, cancer drugs against cancer cells. It's the same principle that this is something that's been developed to protect us from having severe illness.
Very good, very good. There's a lot of discussion, and there's some questions from the audience saying, as you said, Dr. George, maybe accusation is a strong word, but the statements that we are highlighting the positives and not the negatives, and therefore there is that's unfair. How do we respond to that? And I open it up to folks to jump in on that question.
I think Dr. Penna tried to saw that question there and try to address some of the negatives as we know it. And maybe she can highlight them again for that question particularly.
Yeah. I would like
Yes,
to
go ahead,
start.
Dr. Penna.
Any medication, including vitamins, that are taken over the counter can cause side effects. If we take vitamin A excessive, we can cause intracranial pressure increase. So it's not just what any medication is, the dose, and the population is taking that. So it's like everybody will think the vitamin A is benign, but if you take many, it can cause a disease in the brain. So it's the same for everything. Every single medication, vaccine has side effects. But as our expert mentioned, the good things overweigh the bad things. Most likely for the, oh yes?
Well, I think you said a very key phrase there. The good things outweigh the bad things. So I think it's only fair that we speak the realities. The reality is a lot more good things to say than bad things, right?
Yeah,
I
and
don't
as I
think
mentioned
it is.
earlier, that for 1 million of doses of vaccine, this is basically for Pfizer, I'm not sure about the other ones, there was just 2.5 side effects like allergic reaction or anaphylaxis. It's little. So we save like almost 1 million lives, because the severity of this disease, we as a physicians see that in the hospital every day. Now, because of the variant, the Delta variant is more contagious and more pathogenic. We are now seeing that kids with pneumonia, we didn't see this before. And as a responsible adults, we have to protect ourselves and protect our kids. There is no yet vaccines for less than 12 years. and they may take some time. We don't know when it will take, how many months, extra months it will take. So we have to be proactive and try to vaccinate as much as possible the adults, and the at the time that we will protect our kids. Regarding the side effects, the minor side effects that will be like swelling at the injection of the vaccine, you will have myalgias, you can have fever, you can have nausea, headache. But that means that your lymph nodes are working, creating the immunoglobulin that will protect your life. If you don't have any side effects, you have to be worried. There's nothing that your body is working regarding this new vaccine that you receive, and your body is not recognizing this as a foreign protein and is not working against that. That kind of side effects are acceptable. There are ones that, for example, in patients that have serious allergic conditions, there are some that develop hives, like inflammation of the skin. There are ones that can develop like anaphylaxia and have to and need epinephrine injection, or there are ones that need to be intubated, but this is rare cases. There are some cases of Johnson and Johnson. I just remember now the thrombosis, like clots in your arteries, that can cause disease. It's true, but the estrogens that most ladies take for contraception can cause the same. There are different medication over the counter. If you don't take in the right dose, in the right time, may cause problems as well. There is no any exception for that. But what we can do is use things in a smart way. If somebody present a serious side effect, obviously this person has to hold this vaccine for the next dose. Actually, National Institute of Health is studying the allergic reactions in patients that receive the first dose. We will have more data regarding this in 6 months around.
Great, great. Let me ask the panel this question. We have talked a lot about getting the information out to the public. We've tried to do this. This forum is part of that effort. The DFP, as I said earlier, supports that effort. We believe that vaccinations is the right approach. But do we believe that more information is true, or lack of information is truly the issue? Do we believe that if we were able to get an avalanche of information out there, that we would sway minds and hearts? Or is this more of an emotional issue? Is this more of a certain, almost a philosophical, ideological issue, and which are much more difficult to sway with information and facts? Let me just ask the panel to comment on that.
Well, let me jump on that, because it's something I don't say we have a battle with, in Barbados, and I guess happens in other parts of the region when you read what's happening in different countries. The uptake of vaccination is not a political issue. I always tell people that it's not a health issue, it's a marketing issue. And I think, that it has to be marketed properly, that we'll have to let people know the benefits of the vaccination, okay? Let them know the side effects, yeah? Let them know the outcome of no vaccination. And and that is where the different fora has to come into place, not just the politicians, because we are so divided politically that when we wait for politicians to tell us to do something, you can be sure that there are people be opposing it, whether it's good for them or not. So I really think that should be taken off the politicians' hands, and different for like the Freedom Party. I know Freedom Party is a political party, but we know we need the medical association, the nursing association, the teachers association, parent teachers association should be going out and marketing, people marketing vaccinations and the benefits of vaccination, so that we eliminate, petty partisan politics. And that's my take on it.
Very good. Other views?
Sorry, Dr. George, you wanted to go?
No, I was just
Yeah,
going to say, I think
George, jump in.
part of it is ideologic, because there are someone asked about healthcare workers are not it's not 100%, right? But some of it is ideologic. But some of it is also people needing to see their friends and family members who have taken it and are okay. And some people also will see their friends and neighbors who have not taken the vaccine and ended up in the hospital, and unfortunately some of them dying or having long COVID or severe illness, right? And then that scares them into action. And then there is another part where it's mandated. So at our institution, right now it's mandated. If you do not have the vaccine by September 20th, I think, then and then you don't have some medical excuse or religious excuse, you will likely be out of a job. And so even with those who have an ideologic, I'm not going to take the vaccine, some of them will take it. And, so and the ideology for some people, it's a moving target also, right? Because I know where all of us here are Dominican and Dr. Pena is Peruvian. We've traveled, at least all of us here in the panel. And guess what? When you have to travel to certain countries to get entry, you have to be vaccinated. And so whatever ideology that we had saying, I'm not taking this, I'm not taking that, we quickly change our attitudes and adapt to what is required, right? So it really is both ideologic and also unfortunately people acting from fear rather than rationalization of the facts at hand.
Yeah, so I will add, I do see your point, Bernard, because the question really is, at this point, I think most of the folks who respond logically to facts and figures have already gotten their vaccine. Mm-hmm. And the people who are sitting on the wayside have some form of ideologic or some other opposition to it that we sort of have to market to them differently than just providing them with information. One question that just came up, it was more of a statement that the vaccine is not safe and we need time to know that it's safe. We know the vaccine is safe. There is safety in the acute event and there is potential long-term effects. When we can look back at other vaccines that are similarly made, similarly produced, have the same ingredients that we've been using for years, hundreds of years, tens of 20s of 30 years. And we can look back and see the safety profile for those ones and know that those are safe. So the idea that we need more time to prove that the AstraZeneca, which is made much like the other vaccines that we use, the Sinovac, which is made much like the other vaccines that we use, the idea that we don't know that it is safe is really just a way of saying, I really don't want to take this vaccine. And so we have to address those folks in sort of a completely different way than just providing facts.
Mm-hmm. Yes, great. And that's kind of the point I was trying to get at. I think I agree with Dr. Lafort that it is marketing. It is certainly marketing, but I think we have to segment the market. I think we have to partition the market and understand who is driven by facts and figures and who's driven by different considerations. And I think I agree with Dr. Lafort. It's a marketing problem. I think the marketing problem though is not so much getting the information out, but more of segmenting the market into the right constituencies and understanding how to talk effectively to those different constituencies. And Dr. George brought up a point that that is a good segue into my next question, which is, there has to be, there will certainly get to a point where there are just differences of opinions of how we move forward on this, and some people will be adamant about not being vaccinated and so on. But what is the role of institutions, organizations, civil society organizations, governmental organizations in setting the right incentive structure to get the citizens to do the best interests of the community? What is the thought process on, for example, let's take a specific case, healthcare workers and frontline workers? Is there not a case to be made that any responsible government would actually, and I know it's a dirty word, but mandate that at least this frontline force be vaccinated to protect themselves as well as to protect the public? Why would it not be reasonable that that the state at least make moves in those directions? I know it's a little bit of a touchy subject, but I guess the general question is, what do we think about the incentives that society must put in place to ensure that the outcomes we desire are obtained?
Yeah, I do think, and you're preaching to the choir with that question, because I do think from a healthcare perspective, not just for the chance that, first of all, when I became a physician, I promised to do no harm. And if I am not vaccinated and I am treating patients who are at high risk immunosuppressed and putting those patients at risk, then I'm potentially doing harm. And I think mandating that healthcare workers who are front-facing, who are interacting with the public, they themselves don't become risk to the patient. And it is fair, and I think there should be a mandate. If you feel, for one reason or another, that from legitimate health concerns, that you can't take the vaccine, then you shouldn't be patient-facing. Outside of that, we do a number of different things in our jobs, and that is mandated that we don't even think twice about. All right? If you're a healthcare worker and you're patient-facing, I think it's totally within the rights of governments, institution to mandate that those folks get vaccinated.
Other thoughts?
Yeah, I could jump in. Yeah. Well, Bernard, there's precedent, because most hospitals will expect healthcare workers to be vaccinated against hepatitis B. Yeah, most hospitals will expect healthcare workers to be vaccinated against tuberculosis, and other illnesses. Most, I don't want to say, will mandate the influenza vaccine. Yeah, so there's precedent, and I'm of the opinion that it should be mandatory for all healthcare workers, because you may be putting vulnerable patients at risk, diabetics, hypertensive, cancer patients, immunocompromised, whether for cancer, HIV, or so on. Yeah, you may be putting them at risk by getting COVID and from maybe within the hospital, outside your place of work, and giving it to vulnerable patients, yeah, and vice versa. So I'm of the view that due to precedents and due to the nature of the COVID infection, that it should be mandatory. There should be mandatory vaccination of healthcare workers. As to other workers, that's debatable. In the tourist industry, you're going to be frontline with regards to meeting visitors coming from overseas where COVID might be more endemic. That may be debatable, but definitely healthcare workers.
Very good. I think we have a consensus here on the panel that those sort of things should be done. But why do we think there is such a reluctance, especially in the Caribbean region, for governments to move in that direction? Any thoughts on that?
There's political pressures, but also I think some members of the government themselves
are hesitant about taking the vaccine and have their own. I mean, we are, at the end of the day, we are all people. And some folks who themselves are not well educated can be hesitant about doing it. But I do think political pressures is a very important reason.
All right. Other thoughts? Okay. Staying along in the same sort of area, intellectual area. It appears just in modern times that the experts are discounted. The professionals are not as respected. There seems to be a competition for the mind space of just the public in general, not simply on this issue, but on many issues, climate change and so forth. Why do we think that professionalism and intellectualism, or those who have trained and have certain amounts of legitimate knowledge are no longer viewed as the people to lead the discussion in certain arenas?
So I can touch on some of that. A few things, I think. One, it's the actual access to information. We say YouTube University. So people have access to information and they become immediate experts, which we know based on those people, like, for example, us and our training, the rigors that we have to go through to consider ourselves an expert in a subspecialty, not even in a generic, I'm a scientist, right? A scientist of a specific thing. And then also something, again, as Dr. Vidal said initially, I think, about the ideology of not, I don't know if it's a political ideology or a social the social context of undermining people who seem to be in authority of whatever it is that they're in authority of. So like science and medicine, even in politics, business, that everybody feels like they have an opinion and that their opinion is more valuable. And that particular thing, I don't know where that came from. But for sure, more access to information where people can Google stuff and then they feel like they can, they can learn, they know everything about a topic from Google or YouTube, has definitely contributed to that. So it's a plus, but it's also a minus because there's no context to that information that they absorb so rapidly.
It's a very good point about contextualizing information. That's one of the dangers, certainly, of online information, is lack of a context as to what is right, what is peer-reviewed, what's correct. Other thoughts on the question? Okay. All right, guys. Let's talk a little bit as we get into it, and time is running against us. But let's talk a little bit about herd immunity. Why don't we explain to the audience what that is and the purpose of that and how that can help us move on back to a certain level of normalcy. And you can take it in any order that we wish.
So herd immunity is when you have at least 90%, depends on the virus of the vaccine. But for example, or MMR, you need 90% of the population vaccinated, so they won't be affected for the disease. So this is a way to protect even the no vaccinated people. At least we need 90%, so the virus won't spread.
And explain a little bit more why non-vaccinated people, even non-vaccinated people, would benefit from achieving herd immunity.
Because the no vaccinated people will keep the virus will mutate and be worse. And in these kids, for example, MMR vaccine, they go to daycare, they go to the park, interact with other kids that are fully vaccinated, and the strain that they have is not the common one, is the one that has mutated. and put in risk the people who are vaccinated?
So I would put, that is very, very correct. So in its simplest form is that if you get everybody else vaccinated, the virus cannot grow and spread. So the few that are not vaccinated are then protected because there's so few and far in between that the virus doesn't have a host to grow and spread and even mutate to become even more dangerous. So the Delta
there's no
variant,
path to them, right? There's not a path
exactly.
to them. Yes, okay.
And so that's what this herd immunity. I have heard, I listened to an expert immunologist, and I didn't realize that. At first, when COVID was, before we had vaccine, we had some politicians in the US who were saying, just allow everybody to get infected and then we'll achieve herd immunity that way. And I heard one expert says, there has never been a disease for which we have had achieved herd immunity through infection. Never. We've achieved herd immunity through vaccination, through the other diseases. And if we want to achieve herd immunity, we have to vaccinate in order to try to protect the vulnerable among us who themselves cannot be vaccinated or who are at risk when they get vaccinated.
If I could jump in here, I might put a little spoke in the wheel of this discussion with regards to herd immunity, because herd immunity, we're trying to build up immunity in a lot of people, so we have less spread among people who are not immunized. But with COVID, we are seeing, especially with the Delta variant, we are seeing vaccinated people get infected again or get infected. So, that notion of herd immunity might be a misnomer or might be a little falsity within, the health department with regards to something we're trying to achieve. What I suspect we'll get with COVID vaccinations is maybe reduction in severe disease, reduction in hospitalizations, but not necessarily a great reduction in people getting infected due to herd immunity, because especially with the Delta variant have shown that people who are vaccinated are just as likely as unvaccinated people to get infected. So the question of herd immunity might be a moot point at some point.
Yeah. So with COVID vaccine, the thought is you're correct. There is the feeling that we may never be able to achieve herd immunity with the current vaccines that are on market. Should there be vaccines that are then more effective against Delta variant, we probably can in the future, and likely we'll have those, but you are correct.
Yes, I was just going to say that is true. I heard today that the Pfizer and Moderna are already developing a vaccine against the Delta and possibly Lambda strain, and that might start rolling out in the winter, late this year, early next year. And so the vaccine itself, remember, was not approved for prevention of infection. It was approved in terms of reducing severe disease, as Dr. Lafont said, right? And that we anticipated and expected that because of the immune response, that would prevent infection. But people are being infected, and are not being hospitalized proportionally, right? So there are less vaccinated people being hospitalized, there are less vaccinated people being having severe disease. And so that is a benefit, and also the expected decrease in viral load, that folks who are vaccinated do not have a large viral load, and therefore a lower chance of having a virus mutate within. As vaccinated people, hopefully the vaccine doesn't hang around long enough to replicate their viral load, that means the viral load is low, and therefore each replication, you have a chance of introducing a new mutation. And so that's part of the protection of the vaccine, of being vaccinated. But yes, I don't know about herd immunity yet, but definitely would reduce the amount of cases if we had more people vaccinated.
So in regards to the viral load, I just read an article recently. I think that's based on some real world evidence. I don't think that's yet peer reviewed, but coming out of Oxford University, that they found that patients who are vaccinated who got infected with the Delta variant has similar viral load as an unvaccinated with who's infected. So a lot of our thoughts, and we're learning more and more, we do know for sure that the people who are vaccinated, they may have a lower infection rate, for one. And if you do get infected, you are much, much, much less likely to have a severe infection. Most people describe it as a little cold or an allergy, as opposed to requiring hospitalization, and you're way less likely to even be hospitalized for your symptoms. And so there is lots of benefit for the vaccine, especially in countries like Dominica, in third world countries, where our healthcare is built more on prevention than treatment. It's more preventative than reactive, meaning that our healthcare system is effective when we prevent disease, because once you have the disease, we are not as sophisticated as a system like the US in treating the disease. We know that for COVID, somebody right now, as compared to a year ago, who had COVID is more likely to survive that COVID because we have developed so many additional treatments and learned so much more about it that we're better able to treat those people. Those level and sophistication of treatment is not necessarily available in third world countries. So the way we attack this disease is trying to prevent people from, one, being infective, and two, having severe infection that they need to go to get higher levels of care. And that has to be the approach for smaller countries like Dominica.
Mm-hmm. Definitely, we don't have the capacity to deal with severely ill people. We do not, and that would be really, it would be detrimental to our health system and to our society.
Certainly, we cannot get overwhelmed. The US is getting swamped in the early days of this thing and could barely hang on and almost broke. A society like Dominica would have no chance. We would be in dire straits. So certainly that's part of the conversation. Let me ask the panel, what do you say to those folks? Because this is a recurring question. It's out there. It's been floated around that says, how were they able to develop this vaccine so quickly? What gives? What is the hidden trick there? What's going on behind this? What are you guys up to?
I will take that. That's right down my alley. So I don't know if you heard, what I do is drug development. I do drug development and trials from stage 1 to approval. In COVID vaccine, drug development is extremely regulated currently. That going from one phase to another is a lot of bureaucracy. For one, the government removed that bureaucracy. So that cut down a lot of time. Second part of it is that in order for an average drug to get approved, the average drug goes through 3 phases of trials. Each phase requires a certain amount of patience. It takes time. So an average oncology drug, in order to get, say, breast cancer drug, in order to get 1,000 patients, in order to really look and analyze the data, it may take 2 years, 3 years to get that population of patients that you want. There were so many COVID patients that it was easy. Getting that trial up and the number of patients that you needed happened like that because there were ample patients. So recruitment, that 2 years, cut that down to a month or 2 months. Okay. And then what also happened is we were able to streamline the process from going to first in humans all the way to a phase 3 in record time. Nothing was skipped to getting to that part. The bureaucracy was removed. The amount of patient population was there, so the enrollment was rapid. And so therefore, what would have normally taken a 5-year process, we're able to get done in a year because everybody was focused on getting it done. Okay, and so that's why we are the way we are. The reason why it has taken so long now for the FDA to actually, so most of these vaccinations were not officially approved. Pfizer vaccine is the only one that has gotten official FDA approval, and that was two days ago. It's because, again, as some people say, we needed a little bit more long-term follow-up information in order to get the safety down pat and know what to expect in order to get full approval. But because of the emergency of the situation, when we got to enrollment, we were able to analyze the data and saw that there's one population who got the vaccine, did so much better than the population who did not. The government had to make a decision about, am I going to wait another year or 2 years for another 500,000 people to die before administering it, or am I going to do it now? And the decision was made to do it now because the study proved that it was effective.
So, Greg, you forgot to add the influx of money, right?
And the money. Oh,
the
yes.
money, because that is how they were able to do all the analyses so quickly. It was also the influx of money, because as you know, it takes money to do a study, to analyze it, to pay people, to recruit the patients, right? And so there was money. And that it was not just from the US government, but from the European governments. So that is why and also the Chinese, the Russian, I guess the Cubans are also now have their own vaccine, right? So people were flooding money into this because the economy had shut down.
Yeah, so I listened to I think the CEO, I'm going to call him the CEO or the chairman of the board of Pfizer, who said when they realized that COVID was going to be an issue and a problem, they sat down and they said, okay, we've been doing vaccine, we have vaccine technology. Is there anything that we have out there that we can do rapidly, that we can get it done rapidly, and money is not an issue? Just get it done. And in general, for an average study, that is not the case. All right, he said, just get it done because it's emergency, it's life or death, and we need to get it done.
And that's such a good point in terms of the funds, because people, as you said, often forget that in almost every human endeavor, it's opportunity cost, and we simply do not put lots of focused funds into sort of a Manhattan project. But that has happened several times in human history, right? JFK said, get a man to the moon and back within the decade, and they put billions of dollars into it, and they were a focused effort, and the best scientists and engineers at it, and the funds to do it. And within the decade, in fact, they did manage to put a man on the moon and back safely. The same thing happened during World War II when there was an existential threat to democracy, and they said, we will develop a nuclear weapon. And an amazing piece of complex technology that it was on the cutting edge of science, and it was able to be done within a few years and deployed against the Japanese, and for better or for worse. But the point is, human beings with intelligence, coordination, cooperation, and unlimited funds, essentially,
and motivation,
and existential threats to the health of those of their loved ones, can certainly get things done in much more rapid pace. So I think we should bear that in mind when that conversation occurs. Anyone else wanted to contribute on that, or should we move on?
Bernard, are we going to address some of the questions out there? Because I think there are some really important questions that have been put forward that we probably need to address before we end this program.
I agree, and I was going to give a little heads up. We will end this here at 10, so we have about 21 minutes left. So I think now is a good time, good segue for us to pivot more to the questions and try to answer some of those. So Greg, if you have one you see there that you'd like to grab and talk to, just go for it, and we'll take it.
Oh yeah, the breast cancer question.
Yeah.
Of course.
There were two of them, by the way.
Oh, I saw one. I didn't see the other one. And if you do get, I saw what.
Well, we have two of you breast cancer folks in here, so one each.
So the question was, what's the impact of the vaccine on breast cancer for survivors? So what we do know for sure is that the arm for which you get your injection, the lymph nodes associated with that arm can often be swollen. So patients who have, and that swollen lymph node look very much like a cancer-filled lymph node. So patients who have breast cancer, who are doing their regular screening mammograms, we're advising those patients to have some time, at least 6 to 8 weeks, between their vaccine and their next mammogram. Because what we don't want to do is confuse what is an inflammation for cancer. And if you do have, and I have a lot of those patients, that if that patient has been vaccinated and we see those lymph nodes that are new, we have them come back for an additional mammogram sometime later on to further evaluate whether or not that was real or not. And then if it's persistent, then biopsy it. We have some patients, especially again in the breast, that's right next to the arm that you get it. Again, you get some inflammatory changes, but nothing that is detrimental. It doesn't increase your risk of having breast cancer. It doesn't decrease your risk of having breast cancer, but there are certainly inflammatory changes that happen in the breast, especially the one closest to where you get your vaccination.
Do you want to talk in general about being vaccinated and having cancer?
Yes.
Yeah.
So being vaccinated, again, people who are in the business that we do, we have a lot of patients who are immunosuppressed. These are the most high risk of patients. If you have an infection in your body and your body is not able to mount an immune response, that thing is going to go unchecked. So therefore, patients who have on active chemotherapy, and we're finding patients who've been previously treated with chemotherapy years out, that their immune system may not be back to baseline, and those patients may be at higher risk. So if you are immunosuppressed, we're asking that you go get the vaccine to be able to protect yourself. You also want to take the vaccine when you have enough of white cell to be able to mount a good immune response. So if your white cells are in there, we have patients who have really little to no white cells, we'd want you to come up first before you get that, so you're able to mount a good enough response. Currently, the FDA has authorized for booster for those particular patients because we recognize that those patients are most at risk and may require an additional boost to get enough antibodies to help defend themselves against infection.
So if you are a cancer patient, as you said, or somehow otherwise immunosuppressed or weakened, it's a good idea to get the vaccine. Correct?
Definitely.
Mm-hmm.
Very good.
Bernard, there's two other questions. There were two other questions. One
yes,
was
take your favorite. Yes.
Was by Dr. Dublin asking about Cuban vaccines, if there wasn't sufficient data. And the answer to that is yes. That we haven't seen the Cuban data, if it had gone under robust trials, and and they need to be peer reviewed before they'll be taken up by the public or by other countries. That's one. Another question was how long after getting COVID you can get vaccinated. The ballpark is 2 weeks. After 2 weeks of having recovered from the infection, you could be vaccinated. Not too sure. We have immunologists here. Not too sure what they do
Let me
in the
just ask
USA.
quickly: is this a good idea to get it? I don't have a position. I'm asking to get it. If you have been infected, is it necessary or a good idea to get a vaccination then, or what is
Dr.
the
Penna, you want to take that?
Dr. Payne?
Dr. Pena, yes, the immunologist.
Yes. It's advisable to do it after three months after the infection period, and it's recommendable because the titers or antibodies will be double, triple, so you will be very protected. Is
So the
advisable.
idea, yeah. So
So it's
the
like a
idea is
super boost. In other
yes.
words.
So
The
this,
boost and the regular vaccine, because we have cases of patients that receive one vaccine and they got, for some reason, they didn't get the second vaccine and they got infected. And they received 3 months later the infection, the second dose, and they are well protected. We wait like 3 months and they got it will be like a booster, considered as a booster,
Right.
but
A
actually
super booster,
the second,
essentially.
yeah. But there are some studies that show that it will be like 2 or 3 times the titers of antibodies that will protect you for a new, hopefully we won't have another variant soon. It will protect you for another infection because you can be vaccinated and you will be protected for going to ICU or have severe pneumonia, but you can get the virus again. You can get infected again, unfortunately. If
yeah.
we don't use masks, we do not wash the hands, and we don't use, as a doctors in the hospital, PPE to protect ourselves.
The biggest concern is getting a vaccine boost so close to having infection is really more about safety. Boosting that immunity on top of that boost that you have, will you have more side effects?
Right. Go past the threshold of safety.
Right. And so that's why we need to have a little time in between.
Okay. But with that consideration in place, it's a safe thing to do, and it may actually have sized benefits potentially.
Right, because we do think the vaccine probably produces a more durable immune response than just being infected.
Right.
And so if you want to be better protected over longer periods of time, then getting the vaccine on top of the infection is probably the way to go.
Very good. There's an interesting question, and I think it's relevant in terms of, can you mix vaccinations offering? Or the various vaccinations out there? How would that work? And how does that come together?
Very interesting question. So there is very little data, very, very, very little data, actually no data out there about mixing vaccinations. So I wouldn't advise it personally.
But people are doing it, right?
People are doing it.
Yeah. Let me jump in here and say, the data is coming out. There are small studies coming out, and definitely in the UK they are advocating it. So it is happening. And it's been accepted where you can mix vaccines. People are going from the viral vector vaccines like AstraZeneca, then taking an mRNA vaccine. So mixing vaccine is happening out there, and we'll get more data on that later on. But it is slowly coming out.
What we don't know is the efficacy of doing that, whether or not that makes a difference. But certainly, like you said earlier, you take what's available.
Sure.
So if that's available to you in your country, and that's the only thing that you have, you take it.
Good. I like the answers. But Geoffrey, Dr. Lafo, as you said, that's an interesting idea, though. Maybe mixed vaccinations coming at the virus at different angles might turn out to be a more effective cocktail. Thoughts?
Yeah, but we're all scientists here, and we're all scientists here. At the end of the day, we have to look at what studies show, You know, we have to look at peer-reviewed articles, maybe meta-analysis of the different studies with regards to mixing vaccines, whether you mix a viral vaccine, then an mRNA, or mRNA and then a viral vaccine. We don't know, and it's all new, relatively new, and we have to look for outcomes. So those studies will definitely hopefully come out later on, maybe within the next 6 months, to know what the efficacy of them are like. But at the end of the day, the vaccines, whether mRNA or viral, they all attack the spike protein. So they're not really attacking the virus in different ways. They're both attacking the virus in the same way. So hopefully it works.
Maybe the only different vaccine though, and it's the least efficacious so far, is the Sinovac, which uses the inactivated actual COVID virus. So instead of just putting the leg, it puts the actual vaccine in, virus in, and that's how this one works. But it is the one that's less efficacious. So it may not be mounting as robust an immune response as the other ones.
Okay, very good. While we wait for some more questions, let me throw this one in there because I think it's relevant in the Dominican context. It's certainly, from a scientific point of view, and as I said, we all sort of have a scientific background. Interesting data point that Dominica has suffered, and there's a recent death that's under investigation, but for the most part, very low mortality on the islands. Even with the infections that we have had. What and I know this is a speculative question, but let's speculate a little bit. What do you think some of the factors might be that seem to be reducing the mortality effects of the vaccine in the Caribbean region and the Dominican in particular? Some people have told me, well, yes, it's definitely the water, but I know that that needs some peer-reviewed assessment. So give me your thoughts on that. I'm thinking vitamin D may have something to do with it.
Bernard, we have to be happy that Dominica is not a very tourist-dependent country. So when the airlines stop coming to Dominica, when the cruise ships stopped coming, Dominica was less burdened with people coming in with the virus. Yeah. So if you look at Dominica's numbers, for quite a while, you're getting a sporadic ones or twos. Okay. And that was early in the pandemic for quite a while until recently. Okay. So one has to ask oneself, if we had the original virus, tourists not coming in, Dominica is doing a good job at limiting, at quarantining visitors, testing at port of entry. Okay, we had very low numbers. Yeah. Now with the possibility of a Delta variant in Dominica, we have seen a remarkable spike in Dominica, and we have had a couple of cases. Next thing we have to ask ourselves is, and I'm going to throw that out there, is our data. Are we recording who is dying? Okay. Are we recording COVID deaths as COVID-related deaths, or are we not? And that's an issue in some countries. And I don't want to go on a record as saying Dominica is not. I'm just saying, is the data putting out there correct? And
is the data noisy in some way? Is data noisy in some way?
Yeah, and that's my 2 cents, and maybe that's where I will stop.
My 2 cents in it is I have to certainly commend how the government and the health services have dealt with this disease in Dominica and have protected folks and been very aggressive about it. Unfortunately, we had some reckless behavior that led to where we are right now. But when we're just talking about protection and why we don't see higher death rates, one is low numbers. So the death rates is in small percentages. The death rates in some country goes from 1.8% to 9%. And even in the places where you have 9%, we probably aren't recording all of who got infected. So the death rate is really, really low. So
it's a sample size issue, essentially.
right. So there's a certainly size issue. And then the second thing is probably the people who are reported to be infected in Dominica based on the activity and the younger folks. All right. Those are the people I think who are probably coming up infected. And the death rate in that population is much lower than the older population. So there are many different potential explanations for why we have such a high death rate, but it really should be zero. Even one is too much.
Of course. So we're saying maybe our vulnerable population. So there's several things I got from the conversation. One is Dr. Lafoy saying, well, we certainly don't have the influx of the disease, which keeps our infection rates low. We also don't have our vulnerable populations likely not getting as interactive, let's see why, I guess, in their activities. And those factors, those combinations, and then a small sample size in Dominica reduces the probability of death. So I think it's a reasonable answer. Other input?
Yeah, I want to add something, two things, actually 3 things. So one, I definitely, as Dr. Vidal said, I commend the work from the Ministry of Health and the vigilance that was from the get-go in screening people, identifying, quarantining. Dr. Laura Esprit, and even her, I think last week or this week, she had this kind of skit, a monologue of someone who was infected and quarantining who was vaccinated but is not vaccinated. Like, I looked at it twice. That it was really engaging, and she delivered it in both English and Creole. So it was really engaging, and the message was transmitted. But also now with the Delta, we have to be very vigilant because we live in most part in multi-level homes in Dominica, right? So we were lucky, I think, in that, and of course, because of the size of our economy and it was more dependent on tourism, had a lower folks coming in with who were infected, right? And then we kept people at bay who were infected. But now with the Delta variant, where it is 6 to 10 times as infectious as the previous strains, we live in multi-level homes, right? So we live with our grandparents, our parents. We also have a high burden of chronic diseases at home, diabetes, obesity, hypertension. And so we have to be careful now, even more than before, to think about the activities that we were doing, that we were like, oh, when nothing's happening, nobody's dying, nobody's getting very ill, because this variant is a bit different. And we have to think about our moms and dads and aunts and uncles and grandmas who live with us. And of course, the kids who cannot be, right now, at least the vaccines that we're using at home are not approved for the 12-year-olds, for teenagers and kids. So they too are also going to be exposed.
Have we become a little less of a community of folks in terms of being our brothers, keepers, a little more callous towards each other? Has that changed over time? Are we less concerned about the guy next door or the neighbor next door? And is that playing a role in sort of the different ways we take a sort of social responsibility? Because certainly we all have our own independent decisions to make, but we live in a society where there's interdependencies. And interdependencies cannot really be handled or dealt with individual choice per se. It has to be an interdependent conversation. So have we lost that sort of social trust, that sort of social concern, or our level of empathy has eroded? And I'm speaking specifically in the Dominican context. Does that play a role in where we are today?
I really certainly don't want to overanalyze it as to what the cause is. Certainly, the community spirit that I grew up with, just in and around my communities in Portsmouth, is not the same. It doesn't necessarily mean that it's not there in sort of a different way. And so I can't necessarily say that that's not the reason. The question is, back in the 70s, would we have a higher rate of vaccination?
Mhm.
Potentially, yes, because we would have less information and less misinformation. Um, and so, therefore, people were more likely to take up what you said. I don't know whether or not lack of community spirit is playing a role there, because I don't want to overanalyze it too much.
Sure, sure. It's a bit of a speculative question, but I think when we talk about the marketing and how we go about it, I think these are some of the underlying questions we have to think through. Say, how do we appeal, to people's community spirit, or find ways, new ways, maybe to get to that sort of vibe. All right. We are right at the 9 o'clock hour, so I will not keep you very valuable time, and I know you need to sleep to deal with your patients and the hustles of your very hectic, strenuous, and intellectually demanding days ahead. So we will wrap things up. So I'll let each of the panelists just share your final thoughts, what you want to leave the public with, what you want us to reflect upon, and I'll say a few things, and then we'll just wrap it up. And again, let me just go. Thank you again for an enlightening conversation, an important conversation, and for sharing your hard-earned knowledge with us. So please share your final thoughts and observations on what you want to leave us with.
I'll go. Thank you very much for having the discussion and inviting me to do that. I think the Dominica populace understands, for most part, how dangerous this is. Everybody watches the news. Oftentimes, we don't feel like it's going to affect us in our own little bubble, but we have just shown that it can. We went from 9 to almost 800 infections in small period of time, and we've had one, probably 2 deaths related to it. As Tammy, one of my friends, wrote in one of her comments that, again, how do we, and we've been addressing that, address the other population, the other people over here who don't really, where facts and figures doesn't make a difference to you. I want you to think more about protecting your family members, your friends, that older neighbor or that older person who took care of you. If you were to bring that to them, they're less likely to survive it as you. And so just be more cautious out there, and take those things seriously, because it's not a joke and it's for real.
Thank you, Dr. Vidal. Anyone else? Just jump on in.
Yeah, well, Bernard and Mr. Ito, thanks for having me on the panel. I think it's pertinent. A discussion, I think, for Dominicans. Vaccination is just one mode of fighting this disease, and we just have to impress that there are other non-pharmacological interventions, wearing our mask, washing hands, social distancing, and being vigilant at all times. It was a pleasure being here, and I hope the discussion continues, not just tonight, but for days to come. Thank you.
Thank you, Dr. Lafour.
So I can go next. Thank you, Mr. Ito, for inviting me to talk to my community home. Oh, by the way, I want to add that Convent High School is the best school because I okay, so it was really a pleasure to engage with folks at home and those who are not at home about the impact of this, the virus and the disease on our community. So again, just to repeat what others have said, please consider taking the vaccine, not to necessarily just protect yourself, but to protect your loved ones, your granny, your dad, your granddaddy, your mama, your dad, your maybe your sick cousins and aunts and uncles, right? And also yourself, if you happen to be have some condition that will increase your risk for having a severe illness. You don't want to leave your family members too early unnecessarily. So it's really about thinking about our community, our immediate community, parents, children, your homestead, because we're all valuable members of this community of ours and of our beautiful country that we do not want to have the health system overburdened and therefore break under this pandemic. So please take care of yourselves, wash your hands, social distance, wear your mask, and get vaccinated.
Dr. Pena, you get the last panel word here.
Thank you so much for the invitation. Enjoy this conversation, and I made me see the things in another perspective as well, as not as a physician, as a patient in the other side of the discussion. I encourage everybody, adults, to get the vaccine. It's safe. There might be mild side effects, as we explained earlier, but the good thing is that we protect our children. Most of them, the youngest, younger than 12, are not yet vaccinated, and we are having in the hospital a rise of cases of children with severe pneumonia. We can do this together to fight diseases. Thank you.
Thank you so much. Thank you so much. Again, a big thank you to the entire panel. The fact that you guys took time out from your valuable schedules to talk to us, to talk to our community, is just very encouraging, and I'm so very grateful. And I think the entire audience is, and the Dominican public who will see this as we're recording it and leave it on our website, will also be very grateful. We hosted this forum, as the Dominican Freedom Party, again, not as a political event, but simply as people who are part of a community. We believe we have a responsibility to be responsible adults and leaders at various levels and in society to get the right things done. And that is the spirit of this panel, and I hope this is the spirit that we engender in many areas around Dominica and on a personal level. I mean, the enemy is out there, the enemy is this pandemic, and we must all as Dominicans, I think, put together any minor differences that we have and lean shoulder to shoulder and face the problem jointly and solve it together. And I think that's a very important aspect of winning. I think it's social and psychological, and that takes togetherness, trust, unity, to face the important issues as good statesmen, good stateswomen, good citizens, to do the right things. In periods of war, we put aside internal differences and we focus on the external enemy, and this is certainly war against this horrible disease. So I want to thank again the panel for the time of the discussion. We will have more of this. I have seen several messages saying useful, timely, wonderful, and they want more, and we will do more. And again, the spirit of the panelists demonstrates our Dominicanness and our ability to talk and to share, and our enjoyment being together as people when we sit and talk together. And that's a good thing. And I think that spirit will carry us forward, and we will continue to do this. And of course, our international friends like Dr. Pena, who is also an honorary Dominican now for having been on tonight.
Thank you. I'd love to visit that beautiful country one time, maybe.
We welcome you to the fold. And so
Thank
we will
you.
continue the discussions, and it's the beginning of a series, because I think getting the information out and answering people's questions is the way to go. So thank you, everyone, again, for participating, and thank you for all those online, all our friends, and all those who have joined in to ask us tough questions. We appreciate it, and we'll talk to you very soon. Good night.
Good night, everybody.
Thank you.